Alrighty, welcome back in. According to the American Cancer Society, lung cancer is by far the leading cause of cancer deaths in the U.S.
And World Lung Cancer Day is August 1st. The hope is to raise awareness about this horrific disease and how you can take steps to better protect yourself.
Yeah, so joining us now to talk all about it, Dr. Johnson, Director of Lung Cancer Research at SCRI Oncology Partners. Dr. Johnson, great to have you here with us. You know, what I find to be so striking about this is the lung cancer deaths are essentially more deaths combined when we think about colon, prostate, and breast cancer. That's very concerning.
That's right, Blake. The statistics can be scary, but there's a lot to be hopeful for. Last year in 2023, there were 240,000 patients diagnosed with lung cancer, and lung cancer will take the life of 365 of our friends, loved ones, and neighbors every day. Wow. But here's the good news. We are improving the survival rate with earlier detection and more effective therapies for the treatment of our patients. At SCRI Oncology Partners and Sarah Cannon, we're really hopeful about this statistic because it shows that the work we do to bring cutting-edge therapies to patients in the communities in which they live is making a difference.
Absolutely.
That's amazing. And for anybody who's, watching right now or who anyone could be at risk, what are those symptoms they should be on the lookout for?
I like to tell my patients, symptoms that come and go are less concerning, but symptoms that come and stay are more concerning and something to talk to your doctor about. So things like chest pain, shortness of breath, persistent cough or persistent respiratory infections, fatigue, weight loss. Those are all things that you should be talking to your doctor about. And if you don't have a doctor, go to urgent care and get a referral to a primary care physician.
Because essentially what you're saying is the sooner we can catch this, the better the chances are. Is there any way that we could potentially, I guess, best position ourselves to be the most healthiest to hopefully avoid this at all costs?
Well, Blake, I do remind my patients that if you have lungs, you can get lung cancer.
Yeah.
And so the single most important thing that we can do is not smoke cigarettes. And if you do smoke cigarettes, set a quit date and make a plan.
Wow.
Other than that, avoiding exposure to things like air pollution, radon, asbestos, and secondhand smoke are important, but also living a healthy life, regular exercise, healthy living, food that has lots of antioxidants in it, leafy vegetables and berries. And most importantly, if you're at risk because of prior smoking, tell your doctor that you want a screening CT scan.
So, I mean, this is really practical steps that you're offering people this morning.
Great tips
and,
there.
I know a lot of folks struggle with smoking, and it's just like, hey, set the plan and follow through with it, right? It can be daunting, but obviously, as Dr. Johnson said, I mean, obviously, it can really help if you can put those plans in motion. So,
thank you so much for being here with us.
Thank you for being here
Thanks
with
for
us,
having
Dr.
me.
Johnson. It's a very important conversation to have. Of course, we'll have all this for you online at WKRN.com.